Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, everybody, and welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She's the director of the institute, and I believe she's traveling from Costa Rica right now. She's at the airport. So, doctor, how you doing?
Very well, Luis. Thank you so much. Yes, I'm just coming back from seeing some patients in Costa Rica. Apparently Costa Rica has outlawed stem cell treatments, unfortunately. And so we have a lot of patients coming over from Costa Rica. So just getting back.
So that's why if you hear any background noise, is because she's at the gate about to board the plane. So we apologize
right.
for that. But we didn't want to miss this podcast, so we decided to record it. And this week will be the sports injuries. That will be the topic this week, the sport injuries. But
right.
I do want to ask you, doctor, for the people that don't know anything about stem cells, what are stem cells and why are they so helpful for sports injuries?
That's a very good question, Louise. I'm glad you took us back to the basics. Sometimes we assume that people know what stem cells are, and I think it's important for people to understand what they actually are and what they do and how they're capable of curing and healing damaged tissues and diseases. And basically, stem cells are cells that can regenerate themselves and basically grow into any tissue that they're stimulated to grow into. Okay? And so what I mean by regenerate themselves is that they can build on themselves and grow. And so when there is a damaged tissue or a tear or like cartilage that has been worn down, or damaged skin, connective tissues, ligaments, tendons, even eyes and nerves and hair follicles. When we place stem cells in those areas, the stem cells literally regenerate and grow those tissues. And so that's basically what stem cells do and how they can help damaged tissues and disease conditions.
How do we process the stem cells and where do we get them to do these
Yes,
treatments?
another very good question. So the sources that we use for stem cells are either the patient's own fat tissue or the patient's bone marrow aspiration, or endometrial stem cells. Endometrial stem cells are stem cells taken from basically the uteruses of young healthy females, and from donors. And how we choose the best stem cell depends on the disease condition. Sometimes it can be up to the patient because sometimes patients aren't comfortable with using a donor. They would rather use their own stem cells. But in many cases, what we do is we decide as a team the best type of stem cell considering the condition being treated, because it's really important that we use the right stem cell for the right condition. For instance, we would want to use, if we're dealing with an autoimmune disease like multiple sclerosis or diabetes or rheumatoid arthritis or any of those number of autoimmune diseases or lupus, it is really, really beneficial to use endometrial stem cells just because of the way they operate with autoimmune diseases. If we're dealing, for instance, with sports injuries and physical injuries and degenerative arthritis and things like that, it would be just fine to use adipose-derived or bone marrow-derived stem cells. So it very much depends on the disease being treated. Another example is autism and neurodegenerative diseases. and autism, they respond really, really well to endometrial stem cells also because of the way that endometrial stem cells differentiate into neural cells and nerve cells and so on and so forth. So that's a decision, an educated decision that we make as a team with the patient as to which type of stem cell to use.
I understand. And what would be the most common? Well, this sounds like a silly question, but what will be the most common sport injury that you will treat? I suppose any sport injury it's treatable. Let's not forget you were treating this patient. He's a sportsman. He's a MMA fighter,
Oh, yes.
but he was treated not because of sports injuries. He was treated because he was a diabetic, right?
Right. Well, we actually treated him for both. We treated him for both conditions. So we
Oh,
treated
really?
him for his diabetes type 1 with endometrial stem cells, and then we treated him for with his sports injuries with platelet lysate and bone marrow stem cells. So we used both with him and very, very successfully. In fact, his name is Jordan Williams. His next fight is November 6th. So please watch for him. It's on a Saturday night.
Well, we for sure would be cheering for him. What will be the most common injury? Would it be on the knees, on the
Yes.
elbows, or
Yes, that's a super, super question. And you're right. Stem cells can be used for all kinds of injuries, but the very, very common ones are definitely knees with football and soccer players. Definitely knees where there's worn cartilage and torn ligaments and tendons and meniscus and so definitely I would say knees are number one, and then we also treat elbows and shoulders, a lot of rotator cuff injuries, and then a lot of hip injuries in older patients where it's just normal wear and tear, degenerative hip conditions where the cartilage has been worn, and degenerative knee conditions also, again, where the cartilage has been worn. Those are very common. And then elbows, I would say, so knees, and then shoulders, and then hips, and then elbows. I would say would be sort of the order of things.
but stem cells can be used for many treatments. Not only sports injuries, but also many treatments as autism, multiple sclerosis. Also,
Yes,
what other issues can we treat, doctor?
yes, we treat. Okay, so autism. We treat Parkinson's disease. We treat all kinds of sports injuries, eye conditions such as retinitis pigmentosa, macular degeneration, um, optic neuritis and optic nerve injuries, and then stroke and spinal cord injuries. We treat, and then all kinds of autoimmune conditions, like I mentioned, thyroid conditions, as well as skin disorders, um, uh, hair loss. We treat all kinds of conditions.
And for sport injuries, what will be like the normal treatment, and when can people start see the improvement?
Okay, so the whole treatment protocol and the comprehensive treatment involves a total detox program, which is what we've coined, which includes a nutritional IV detox with antioxidants and all kinds of nutrients and minerals. And then that's followed up with organic suppositories as well as intramuscular B vitamin shot. So that's the first part of the comprehensive treatment. And then we will also use growth hormone, depending on the patient. For instance, if we have a professional patient, which we do many times, we won't use growth hormone because they would be tested for doping. And so we won't use growth hormone, but in cases that we can safely use it, we will for a few months just to sort of rejuvenate the body. So we'll use growth hormone, and we definitely use oxygen therapy. So it can be exercise with oxygen or hyperbaric oxygen therapy, as well as our stem cell enhancement formula, which contains key herbs and minerals to help the stem cells along. And so that's sort of the treatment in a nutshell. And then, of course, the actual stem cell treatment all along with that. And the whole treatment lasts about 3 months, where the patient isn't in Guatemala for 3 months. They're only here for a week or two, depending on what's being treated. But we send them home with the rest of the supplements and whatever they need for up to 3 months.
That is great. And if we have any sport people that want to come to Guatemala, can we arrange everything for them as far as lodge and the whole treatment?
Accommodations, and we help them with flights. Absolutely. So we have a driver or a chauffeur for them. We have that takes them to and from appointments and airport transfers and anything they need, pretty much. So we have a chauffeur. We arrange accommodation, and we also help with flights. So we take care of everything. So there are no worries.
Okay, and how can they reach you, doctor?
Yes, thank you. So they can reach us and on our website at www.stemxcure.com, or they can email us at info@stemcellhealinginstitute.com, and they can also call us at 209-690-7836. That's 209-690-7836. That's our U.S. number, and our local Guatemalan number is +502, which is the area code 4220-7297.
And please visit our website. That will be www.stemcellhealinginstitute.com.
That's right. And they can also visit us on Facebook and Instagram and our YouTube channel.
That's right. Doctor, is there anything else you want to add to this podcast?
No, I think we've covered everything. I'm happy to take answers and emails and any kind of inquiries and phone calls from listeners. So we look forward to hearing from you.
And we also want to apologize for all that background noise that you heard on this podcast. We understand. Yes. We understand that the doctor is traveling back from Costa Rica. So you have a nice flight and back to Guatemala, and we'll be hoping we can see you tomorrow.
Thank you so much, Luis. Thank you. Have a lovely evening.
You too.